Hello and welcome to today's show. I'm Jamie Smith, the Cancer Control Specialist with the Kentucky Cancer Program. The Kentucky Cancer Program and our district cancer councils have launched a 3-year statewide program for campaign for colorectal cancer awareness. Colorectal cancer is the second leading cause of death in Kentucky and the nation. This is all the more tragic because colon cancer is one of the most preventable cancers if detected early. On your screen, you'll see a pie chart that actually shows the screenable cancer mortalities in the Purchase area. And you can see by that chart that colorectal cancer does make up the majority of mortalities in our area. Many people may not like talking about colon cancer in the screenings, but we know early detection can save lives. Here are just a few statistics to begin our show today. According to the American Cancer Society, they estimated that nearly 147,000 people would be diagnosed with colorectal cancer, and almost 50,000 would die in the United States last year. In Kentucky, the estimates were 2,620 new cases of colorectal cancer and 840 deaths. The Kentucky Cancer Registry often lists the incidence of cancers in our area as well as mortality. For 2000 to 2006, you can see the incidence graph on your screen, and it shows that there were 12,372 cases of colorectal cancer diagnosed across the state of Kentucky. The Purchase area had 650. We ranked 14 out of 15 in the state for diagnosis. Next, you'll notice the mortality chart, which shows 4,501 deaths of colorectal cancer and 236 deaths in the Purchase area for that same time frame. The Purchase area ranked 13 out of 15 in the state for number of deaths. We have some work to do in our state, and of course our campaign is going to be a major factor to decreasing those numbers across the state. Joining me today is Teresa Cash, RN from Western Baptist Hospital. Thank you for joining us today.
Well, thank you for having me. I appreciate it.
Well, we're certainly excited to have you here and to learn a little bit more about colon cancer and the screenings that are useful in early detection and, of course, increasing the survival rate and then, of course, hopefully to decrease the actual number of cases that are diagnosed. Teresa, tell me a little bit about yourself and what exactly you do at Western Baptist Hospital.
Well, Jamie, I've been a registered nurse for 18 years. I graduated from Paducah Community College. I'm presently attending the University of McKendree College, and I'm the Director of Outpatient Surgical Service at Western Baptist Hospital.
Okay. If you wouldn't mind maybe just starting off telling us why you believe that colon screening is so important.
Well, colon cancer does not always start out with symptoms. That's very important to remember. This means that, someone could have colon cancer and not even be aware of it.
Right.
So that's one of the most important things. Few cancers are easily prevented as colon cancer. Mm-hmm. Colon cancer screening has been proven to reduce colon cancer by 90% if you're early diagnosed.
Well, we definitely want to see those. Let's first talk a little bit about colon cancer and maybe get back to the basics a little bit and explain some things to people out there. What exactly is colon cancer? What's the difference between colon cancer, and you often hear it referred to as colorectal cancer too, so maybe we can distinguish those two items first.
Well, colorectal cancer is cancer that occurs in the colon and the rectum,
okay, and
it's also called colon cancer. So, colon is your large intestines, or people call large bowel, and the rectum is the lower part, 6 inches of the digestive tract. Okay. And it serves as the holding area for people's stool. Mm-hmm. So this is if the rectum connects the colon and the anus. Okay. So really, colon, rectal cancer, and colon cancer are referred in the same
manner.
Mm-hmm.
Okay. Well, next, let's just take a few seconds to kind of talk about the risk factors for colon cancer, and we're going to have a graphic we'll be able to put on the screen so people can see those as well, but perhaps you can go into a little bit more detail about these risk factors so people can understand them a little bit better.
Well, the risk factors for colorectal cancer are a family history of colon cancer. Definitely age, mm-hmm. If you're 50 years or older, which we'll mention that, a little bit later in the show. If you've had a history of colon polyps, inflammatory bowel disease, such as ulcerative colitis, Crohn's disease, things like that, okay, would put you at a higher risk. Genetics, your diet, the race, and also cigarette smoking.
Mm-hmm, of course. And we'll talk a little bit more about those risk factors and what those actually mean if some people may have some of those risk factors, what that means for their screenings a little bit later as well. Next, let's talk about some of the signs and symptoms. I know that you've said sometimes it's not noticeable at all. There are no symptoms and no signs, but there are some, and we'll also list those on the screen so people can see those, but allow you to go into a little bit more depth about those as well.
Like we had said before, you may not always have symptoms. You could have change in bowel habits, and those things are such as diarrhea, constipation, feeling that the bowels do not empty, blood in the stool, or a change in the appearance of your stool. I know that a lot of times these are embarrassing things that people don't like to talk about, but these are the signs and symptoms. General abdominal discomfort, fatigue due to a hidden blood loss. You could have a blood loss in your stool and become anemic, and that's where you come in. The fatigue comes into play. Weight loss or having nausea and vomiting. Okay. So these are some of the symptoms that really need to pay attention to.
Okay. So definitely if someone's having these, they need to tell the doctor and not be, embarrassed to say something to their physician about it, because it's definitely something that we want to catch early. Mm-hmm.
And a lot of times people, these are signs and symptoms of everyday life. You may think that you ate something wrong and, you feel bloated. But if these symptoms go on for longer than 2 weeks, we recommend that you call your primary care provider.
Great, that's great advice. Another thing people may wonder out there, talking about the signs and symptoms, but what's really causing those symptoms inside? And people may hear the word polyp and they may not exactly know what that is. We have some pictures that we'll be able to show them, but maybe you can go into a little bit more depth about what actually a polyp is and how it grows inside the colon.
Well, first thing you need to remember that if you are diagnosed with a polyp, that doesn't necessarily mean you automatically have colon cancer. Polyps are finger-like projections that grow on the mucosal lining of the large intestines or other areas of the body, but we're specifically talking about colorectal cancer today. But, polyps, there's two different types of polyps as you see on the screen. There's a small polyp on a stem. This is called a pedunculated polyp, and that is on a stalk. There's also flat polyps, and then there's on the screen you'll see that there's a picture of large polyps. And larger polyps are at greater risk for colon cancer. Large polyps sometimes have to be removed surgically. Doesn't mean that they're cancer, that just means they're higher risk to turn into cancer.
Okay. So these polyps are in there, but some people may not really know how does a doctor actually discover that a person has a polyp? Most of the time a polyp is discovered and removed at the same time because if you meet the criteria and you have some of the signs and symptoms are high risk, your primary care provider will recommend that you have a colonoscopy.
Okay.
And we do have a picture of a colonoscopy as well.
A colonoscopy is a test that allows your doctor to look into the inner lining of your large intestines and your rectum. They use a thin, flexible tube. It has a camera on the end of it, and it guides you through the camera guides you through the colon. A colon helps find polyps, ulcers, and tumors. Since most polyps are asymptomatic, as we discussed earlier, they are usually discovered at the time of your colon screening. Polyps are routinely removed at the time of your colonoscopy, and they can be removed or biopsied with what we call a polypectomy snare or a biopsy forceps. Even though colon cancer is usually not found in polyps smaller than 2.5 centimeters, all polyps are biopsied or removed at that time.
Okay. Now, once a polyp is removed, can it come back? I mean, do polyps grow back, or is it once it's gone, it's gone?
Well, colon polyps have been known to grow back. If you've had polyps removed before, then it's very important that you follow up with your physician and have testing to look for more polyps in the future.
Okay.
But that is where, when you have the colonoscopy, your doctor will give you the recommended date to be for your colon to be reviewed with another colonoscopy.
Okay. So this colonoscopy is an outpatient procedure that they will receive at the hospital, but how would a person actually prepare for their colonoscopy when they meet with their doctor? What's the doctor going to tell them that they need to do?
Well, there's a lot of preparation routines that vary, and that's according to your gastroenterologist.
Okay.
He will instruct you on what's best type of colon prep that's best for you. But the first step to having a colonoscopy, Jamie, would be that you need to see your primary care provider, because then they will identify whether you're at high risk or you meet the risk factors, or if you are suffering from signs and symptoms. So the first thing you need to do is see your primary care provider, and then he will direct you in the correct steps to see a gastroenterologist.
Okay. So the primary care physician would then refer to the gastro doctor for that individual. Now, will the individual go meet with the gastro doctor before the colonoscopy, or will they meet him the day of?
The primary care provider's office will make you an appointment with the gastroenterologist, and then they will set up the procedure, the time, and when you will be scheduled for your colonoscopy. The main thing is the goal of the colonoscopy prep, because that's what we were talking about, is, you know, what do we do to have a colonoscopy, is to eliminate all the fecal matter that is in your colon.
Okay.
So, you know, most people who have a colonoscopy would agree that the worst part of the whole colonoscopy process is the prep. But what people have to remember, yes, that is the worst part of the whole process, but it is the most important part of the process,
Right.
because you have to get your colon cleaned out for the gastroenterologist to see a clear view of your colon.
Right. And I know that they often give them, of course, the drink that they will drink the day before to flush their colon out. But also they need to watch what they eat before the colonoscopy as well, like certain colored foods they need to avoid. And what reasoning is behind that?
Well, that is so that the prep will actually clear and eliminate all of the fecal matter that's in your colon.
Okay.
So there's things that are harder to digest than others, such as red meats, red food coloring, dyes in foods, but you will get complete instructions from your gastroenterologist prior to arriving to the hospital, and actually prior to even starting your prep on what those are.
So the main thing we need to know about the prep is that we're definitely going to clean our colon out so that we can get the most clear picture of what our colon actually looks like, so that they can see if there are any polyps in there.
And remember, that's the worst part, and that is the most important part, because the physician, if you're going to have a colonoscopy, you would want to make sure that the colon is clear, so that the physician can diagnose and not overlook anything.
So people just need to take the day off and sit down with a good book and stay at home for the day.
That's right. That's right.
Now let's talk for just a little bit about a person's at home, they've prepared, and then they're getting ready to go to the hospital for their procedure. So what would a person expect on the day of their visit for the colonoscopy?
Well, at Western Baptist Hospital, we have most frequently asked questions. You know, first question is, where is digestive health?
Right. That's a good one.
Digestive health is located in Doctor's Building 3, and it's on the second floor. And we have convenient parking located on the second floor of the parking garage. We designed that initially that way because you can park on the second floor of the garage. You walk across the catwalk, which leads to Doctor's Building 3, which actually puts you into the Center for Digestive Health lobby.
Okay.
So, and that's where that your family and your designated driver will wait for you.
Okay. All right. What are some other questions that people have there?
They want to know, do we have to register once we arrive? Yes, there's a lot of paperwork involved. By the time that you've arrived at the hospital, you've already went over your informed consent with your physician,
Right.
the gastroenterologist, but then there's paperwork that Western Baptist has to complete. So Western Baptist, you will register when you get there.
Okay.
Some of the other things is people want to know, how long will I be at the hospital? We tell people that you will be there an average of 2.5 to 3 hours for the entire process.
Okay.
And then people want to know, am I going to be asleep for the procedure? That's
so.
the main thing, right? Well, once you arrive and we prepare you, you've registered, we prepare you for the procedure, you will talk to your physician prior to the procedure. So that is called what we call timeout. There at the hospital, Jamie. That's if anyone has any questions that you forgot to ask the doctor, you know, in the office.
Okay.
So that's a specific time that is set aside for you and your physician to discuss anything that you might have forgot. Everyone does receive sedation during the procedure. It is what we call conscious sedation. It is the deepest sleep you can be put in and be breathing on your own.
Okay.
A lot of people call it twilight sleep. It's where you're awake, you're breathing on your own, but you're not aware of what the procedure being performed.
Okay.
So Another thing that people want to know is, when can I return to my normal activity? We ask that the day of the procedure, you go home after the procedure, you rest, you take it easy. You're dehydrated, so we want you to increase your fluids and gradually increase your back to your normal diet, you know, if the physician gives you the orders to do that.
Okay.
A lot of people, that's one thing they want to know: when can I eat?
Right.
And after your procedure, the physician will talk to your designated driver or your significant other that came with you, and we will keep you about 30 minutes to an hour. The reason this is that we want your vital signs back to the closest to the pre-procedure state as we can get them, and you be stable, so that when you go home that day, you know that your vital signs are stable and that your family are not worried about, you know, post-procedure. Once we discharge you from the hospital, we give you what we call home care instructions. Those are instructions of things that are normal, abnormal once you get home, and we also give you the healthline number to call back if you have any of those complications or concerns.
So if they need to go back, then they can go back.
Yeah. A lot of they want to know, how long does a colonoscopy actually take? Well, that can vary on individual basis.
Right.
An average would be 30 to 45 minutes, and that would be according to how many biopsies or polyps that the physician takes during the procedure. But the average is 30 to 45 minutes. And then people want to know, how long does it take to recover and go back to work?
Right.
We suggest, like I said previously, that you take it easy that day, but the next morning, if the physician recommends that, then you go about your daily activity the next day.
Okay. So maybe 2 days off work and then return back. Okay. Now, one thing you just said too is, whenever they remove the polyp and they're going to test it to see if it's cancerous, how do they actually do that? What does that actually entail? There
is 2 different procedures you can do when the physician identifies a polyp in the colon. You can do a polypectomy snare, and that's where they actually remove the polyp and send it off. And some of the physicians, if the polyp is very, very small, you would take a biopsy of it and send it off.
Okay.
And then during your recovery phase, the physician, when they talk to your family or your designated driver, they will tell them when they expect the results to be back, and then you have a follow-up appointment with your gastroenterologist to discuss those results.
Okay. All right. So we talked about the prep and how some people are just really anxious about that and uneasy about it. So what's some good advice to give someone that might be a little bit more nervous about the prep part of it?
Well, the main thing is to think positive about this. Go into the prep with a positive attitude. Remember that there's been thousands of people that's taken the prep,
right,
and you will get through it. And actually, like I said before, remember, this is the most important part of the whole process, is the prep, not what the doctor's doing, but actually what you're doing yourself. So I suggest go into it with a positive attitude. Stay busy that day. Get reading materials, things that are close to the bathroom.
Yeah. Now, some people may think, you know, you're going to lose quite a bit of weight that day, but does that weight stay off after?
No, you're just actually losing water weight. So once your body regulates back to its previous state and not being the dehydration state, so that this is not a weight loss plan. So
it'd be nice though sometimes if it was. Right?
Yeah.
A lot of people dread having a colonoscopy, and some people may put it off and not want to talk to their physicians about it. And the physicians may say, you really need to have one, and they're just too anxious about it. So what advice do you have for those people that are just even too scared to even think about having a colonoscopy?
Well, I just want everybody to remember that age is one of the most common factors, of colorectal cancer. Since 90% of the colorectal cancer cases occur in age 50 or older, that's why it is so important to do that preventive screening.
Right.
And if someone that you care about, Jamie, that is age 50 or older, I just recommend that they do have a preventive screening, or if they have the signs and symptoms.
Something that you can kind of talk to them about. Well, there's a lot of different screening options. We've talked a lot about the colonoscopy today. There are some other options that are available. However, the colonoscopy is the standard because it does view the whole rectum and colon. But there's some guidelines that we're going to put on the screen for you all to be able to see. But Teresa, if you wouldn't mind just kind of mentioning some of those and what they are. But of course, we've talked a lot about the colonoscopy as well. But let's mention some of those other ones.
Well, the screening guidelines for colorectal cancer, like you said, you'll see on the screen, is that beginning at the age of 50, both men and women are at average risk for developing colorectal cancer and should use one of the screening tests below. Tests that provide polyps and cancer are the flexible sigmoid scope, which are done in the physician's office, the colonoscopy, the barium enemas, and the CT colonography, which is what we call a virtual colon.
Okay. And one thing we want to make note too are those years that were on there. That's for the normal at-risk person. If you have polyps and things like that, you would have those done more often.
That
at
is
high risk.
That is correct. Now there's some other tests that you'll see that are they're called FOBT tests, and those are the tests that are usually done in the physician's office or at home. That's the little card that that you do. You do a stool sample on the card, and that detects blood. And also the what we call the FIT test, that just does exactly the same thing, but it becomes more detailed and can catch blood that is higher in the digestive tract.
Right, and it can also tell the difference between animal blood and human blood. So if you've ate a lot of red meat or something.
That's correct.
Okay. All right. So we talked about how often a person should get screened, and you've said that kind of depends on basically what the physician finds. If you're at higher risk, and we talked about some of those pre-existing conditions that a person may have, such as the bowel disease or some of the risk factors, family history. So 50 is not necessarily the age to start. If you have those risk factors, they could need to start earlier, correct?
That's correct. Yes, if you had those risk factors, you could even have a colonoscopy at 40 or before.
Okay. All right. And then I've met several people that have had colon cancer before, and they often have to have their colonoscopies done a lot more often than even 5 years, even maybe 6 months to a year. So definitely talk to your physician and find out what is best for you for those screenings.
And then following your colonoscopy, the gastroenterologist, like you said, once he has his findings, then he will tell you how often you need to be
for the
reevaluated.
Okay, all right. Now let's talk a little bit about things that we can do to actually help reduce our risk for colon cancer, and we have some tips we'll put on the screen for you. But Teresa, if you wouldn't mind just going over some of those so that people can maybe start today changing their behavioral patterns as well.
Well, the different things of ways to prevent colon cancer would be removing the polyps if you're high risk or if you have the signs and symptoms, having a colonoscopy screening, and then if they have polyps, you would have those removed. Decrease your fat in your diet. Eat 5 to 9 servings of fruits and vegetables a day, and limit your alcohol intake. And don't use tobacco products. And of course, we got to add that exercise regularly.
Right. You want an overall healthy lifestyle, and of course, diet and exercise plays an important part of that. What is the one message you want our audience to take away from today's program?
Well, colon cancer is the number 2 cause of cancer deaths in Kentucky, and that 9 out of 10 cancers may be prevented or cured with regular colon screening. If you're 55 or older, or have a personal family or friend, or family history, I suggest that you please talk to your doctor. That colonoscopy screening does save lives.
And I think that's very important. People need to realize that colon cancer is one of the most preventable cancers, in the world, and it's just like going to get your mammogram or going to get your pap smear as a woman, or for a man, allowing the doctor to check his prostate. It's something that needs to become regular for people. And so let's talk a little bit about some of the educational pieces that we're doing as a District Cancer Council. Teresa belongs to our District Cancer Council as a representative of Western Baptist Hospital, and each year March is designated as Colorectal Cancer Awareness Month. And we've certainly are trying to make our mark this year with some different activities. So would you mind just kind of sharing some of the information that's going to be happening across the state and what's going to be happening here locally as well?
Well, Jamie, there's a lot of activities going on in the month of March at Western Baptist Hospital. You can get on our website and see the dates that those will be available. But main thing is just we're wanting to educate the community. I've had I've had 3 people in my family that have passed away with colon cancer, and that's why that I feel like it is so important to educate the community on colon rectal screening. So that's Western Baptist Hospital. That's what their focus is on, is educating the community. Because the 3 people in my family, if we would have had all this going on during their time, and they would have been educated, that would have possibly prevented that.
Right.
So.
Well, thank you, Teresa, for sharing this important information with us today about colon cancer. And for more information about services provided at Western Baptist Hospital, you can phone the Baptist Health Line at 270-575-2918. Teresa talked a lot about the activities that are going on in the community and the strides that the District Cancer Council is taking to decrease the incidence of colon cancer across the state of Kentucky, and especially here in the Purchase area. And if you'd like more information on some of the materials that are available to share with your church or your organization or anybody else in the community, you can contact our office, the Kentucky Cancer Program, at 442-1310. We encourage you all to check with your doctor to make that appointment and ask your doctor about what screening test is right for you for detecting colon cancer, especially if you're age 50 or over. Routine screening is highly effective. As Teresa mentioned earlier, 9 out of 10 colon cancers may be prevented if cured if detected early. And so for more information on today's show, please call the Kentucky Cancer Program at 270-442-1310. Thanks for joining us today, and we'll see you next time.